From the time settlers arrived in the area in 1861 through the turn of the century, there was no hospital in southwestern Utah. Life expectancy at the time was very low. In fact, half of all the children born in the area at the time did not survive to adulthood. Then, on July 8, 1913, Dr. Frank Woodbury and Dr. Donald McGregor opened a hospital on 100 East in St. George.
Now, a hospital is simply a room where you do surgery and some recovery rooms. And they had access to a house right in the middle of downtown, and they opened a hospital. And it had 4 beds in it, plus 6 recovery rooms, and a surgery room and a dental office.
The McGregor Hospital was built to, quote, sanitary standards. It would have had more plumbing inside, more places to wash your hands, than a normal home would have. It had fresh air. Back then, it was very small, but all the rooms would have had large windows that could be opened.
By the end of the 1940s, McGregor Hospital was showing signs of age and was no longer able to meet the needs of the community. The county commission agreed to build a new 30-bed hospital. The Dixie Pioneer Memorial Hospital began treating patients on August 2, 1952.
That hospital obviously didn't have very many modern things. I remember bringing the first chest tube here, the first blood gas machine, things which we all take for granted today, but it still met the needs.
By 1969, the Dixie Pioneer Memorial Hospital was unable to meet the demands of the quickly growing community. It was decided that a new hospital would be built adjacent to the existing facility. It would have 65 patient beds and the ability to expand as the community grew. The new Dixie Medical Center opened in December of 1975. In 1974, while Dixie Medical Center was still under construction, the Church of Jesus Christ of Latter-day Saints announced its plans to divest its healthcare network. Intermountain Healthcare Incorporated was formed as a nonprofit healthcare organization and assumed ownership of the church's 15 hospitals.
The board members came into their assignment absolutely determined that they were going to help make this a model healthcare system that would offer health care at a very attractive cost to patients, and also have a real focus on quality and try to be a model for the nation and maybe even the world.
The Washington County Commission knew that they did not have the resources to fund future expansions to the hospital. They also knew that they did not have any expertise in hospital management. They decided to sell Dixie Medical Center to the newly formed Intermountain Healthcare in 1976.
Became a great deal for the county, became a good deal for Intermountain Healthcare, and it became a tremendous deal for us because Intermountain Healthcare had both the expertise and the money to help us expand and stay ahead of the expansion of our community.
Many specialists were added to the hospital's medical staff in the 1970s and 80s, and the hospital grew physically broader and taller through a series of expansions.
Back in the mid-70s, as specialization started to become more prevalent throughout the nation, many communities that had just family physicians actively resisted that. I mean, that was a big threat for some family docs to have specialists. And our physicians back then, they were nervous about it too, but they accepted it and even embraced it. I mean, they helped recruit specialists into the community because it was the right thing to do for their patients. And that has made a huge difference, and that attitude has continued through to this day.
A cancer center was added to the hospital in 1985. At the time, it was named the smallest fully accredited cancer center in the nation.
The establishment of the cancer center elevated our capability beyond primary care and truly was the first giant step towards becoming a regional medical center.
Because the hospital was now serving patients